Omicron cases continue to surge, overwhelming hospitals across the province. Alberta health officials announcing a strategy to take pressures off emergency rooms. Field hospitals have been set up in both Calgary and Edmonton and will begin accepting patients this week.
This temporary measure is one of the initiatives that will ensure that our healthcare system can meet increased demand caused by COVID-19.
The pandemic response units will be located at Calgary's Self Health Campus and Edmonton's K Clinic, with 12 additional beds opening in Calgary and 18 in Edmonton. Also announced, major surgeries will go on as scheduled because intensive care capacity is in immediate danger right now, but some minor surgeries will be postponed due to the strain on the healthcare system.
In the past 7 days, the number of patients with COVID-19 in our ICU has increased by about 18%. Our EMS and emergency department teams are also facing volume increases of as much as 30%. Calls to HealthLink are up by more than 300% compared to pre-pandemic times.
Jason Kenney says that we have not yet seen the peak of hospitalizations, but it's not all bad news.
The good news is that there are some early indications that Alberta has reached and surpassed the peak of infections in our province.
Also adding that the province is expecting about 9 million rapid testing kits within the next 2 weeks. Meanwhile, the NDP's health critic David Shepherd says the situation has become out of hand.
Albertans simply can't trust the UCP. Healthcare workers had barely recovered from the fourth wave that was fueled by this government, the UCP's best summer ever. The system is still struggling to catch up on the surgeries that were canceled during that time. Yet here we are again, with the UCP's negligence putting Albertans at risk, not just of a potentially serious COVID-19 infection, but also of canceled treatment for other serious health problems. We didn't need to be here.
In Calgary, Jasmine Vicarious, City News.